Hello everyone, my name is Megan Seeds. I will be presenting today on my behavior change project. The participant in my behavior change project was a 10-year-old boy diagnosed with autism by a medical doctor. He might also possibly have side effects from fetal alcohol syndrome, but that is unknown because he was adopted from Russia as a baby. He attends an ABA clinic. At the clinic, he is in a classroom setting. The setting is set for clients that will be moving from the clinic to school soon, and they work on academic tasks and behavioral tasks as well. The target behavior that we worked on was argumentative and out-of-context questions. These were operationally defined as any instance in which the client engages in the vocalization of a sentence or word that elicits information that does not fit in the context of the conversation or is a verbal objection or protest. These could be anything from the client saying, why does he have to do something? One vocalization that he does, he says forever a lot. Pretty much it was determined by parents and teachers that the majority of a conversation would be out of context questions or just argumentative questions to either delay a task or gain more attention. Both teachers and parents identified it as something that was hindering his ability to have an everyday conversation. The measurement I used was frequency. The behavior technicians that worked with him used a clicker to take frequency data on the amount of questions that were asked per session. I figured this would give the best overall picture of the amount of questions that were being asked during each session. The design that I used was a reversal design. We started with baseline, moved to intervention, did a return to baseline, and then a return to intervention. This would show if the intervention had an effect on the behavior and if it was effective overall. During baseline, data was taken on the frequency of the questions for the 2 3-hour sessions. There was an AM session and a PM session. Nothing changed from the daily routine that was happening. There was no changes during baseline. The behavior text just took the data and then recorded what they found. The treatment that I used was differential reinforcement of lower rates of behavior with a response cost. I didn't want to completely put the behavior on extinction because asking questions is something that's really useful. So I just wanted to lower the rate of the behavior itself. The AM session had an average of 90 questions, and the target number that was used for the DRL was 75. The average number for the PM session was much larger. It was 246, with the target being 231 questions for the DRL. For both sessions, once the number of questions was reached, then it was stated that he had reached the allotted amount of questions. If he continued to ask questions, it was explained that he would lose a token from a token board. Each token represents 10 points, and he needed 30 points at the end of the session to cash in for 5 minutes for reinforcement. If at the end of the session he had 3 or more tokens, then he was able to cash in for whatever he wanted for those 5 minutes. The behavior text took data on the number of questions asked per session and the amount of points that remained at the end of each session from the token board. IOA data was taken 2 times during each phase, so that would be 4 times total for each phase because it was for 2 days, so it was twice in the AM and twice in the PM, with a total of 10 sessions per phase because there was 5 days in each phase. That would be 40% of sessions that had IOA data. The baseline IOA average was 96%, and the range was from 88 to 100%. The intervention IOA average was 96.75%, with a range from 90 to 100% for the amount of questions asked, and then for the number of points remaining, the average during treatment was 81.25%, and the range was from 25 to 100%. There is no IOA data in baseline for the points because the points were not present and we didn't take data on them. As far as the results go, overall it showed an improvement with the intervention. During baseline, like I said, the average number of questions in the AM was 90, and the average number of questions in the PM was 246. With the DRL and the response cost, the average in the AM was 77.8, and the average in the PM was 235.2. With the return to baseline, mean went back up to 79.8 in the AM and 255.6 in the PM for questions. With the return to DRL in the AM, the mean dropped again to 75.8, and in the PM, the average was 231.6, which was also a decrease with the return to intervention. For generality or generalization, there wasn't really a specific program in place for generalization. It was something that could have been improved upon overall in this study. The intervention showed positive results. It decreased the amount of questions that was asked. It would be interesting to look at why there was such a large increase between the AM and PM sessions. I think that would be useful information. The plan for the future is to continue with the DRL and then start to slowly lower the amount of questions that are acceptable during the intervention stage so we can hopefully decrease the amount of questions being asked even more. Thanks.